Acute kidney injury in critically ill children. Sorry, excuse me. Okay, well, here I'm gonna show who I am. Okay, definition. Acute kidney injury, also known as AKI, is defined as an abrupt or rapid decline in renal filtration function. AKI is a clinical condition that commonly occurs in critically ill patients in the pediatric intensive care unit. Well, that's a definition. Here we have a video. I'll show it later. An application in medicine. They found the lower age, higher PRISM score and presence of cardiac disease were independent risk factors for development of AKI. Though AKI was not an independent predictor of mortality, patients with AKI had significantly lower PICU that stay and hospital stay compared to patients without AKI. Here I have a video of kidney injuries. Okay, so pros and cons. Pros. They found that though there was a significant trend of higher mortality with higher AKI stage, AKI as a whole was not an independent predictor of mortality. The increased mortality seen in patients with AKI is largely because patients with AKI are more sick with more organ failure and increased need for mechanical ventilation. Cons. This study has some limitations. It was a single center retrospective study using existing medical records, which caused some difficulty in the assessment of AKI. We did not use a urine output criterion as exact documentation of urine output was not available from records. Okay.
Risk factors. Risk factors for developing acute renal failure include the presence of a chronic disease like kidney disease, diabetes, heart disease, high blood pressure, or liver disease, blockage of the vessels in the legs or arms, and/or peripheral artery disease. Other causes can include bleeding, dehydration, increase in age, usually ages 65 and above, the usage of ACE inhibitors, overuse of certain over-the-counter painkillers such as NSAIDs like Advil and ibuprofen, and naproxen. Causes. There are 3 sites in the renal system that can get affected, causing abrupt renal failure. They are pre-renal, intrinsic, and post-renal. Pre-renal means before the blood enters the kidney. Intrinsic means within the kidney, and post-renal sites are where the urine leaves the kidney and enters the ureters. Pre-renal. If this part is affected, the kidneys do not receive enough blood to filter. The reasons can be dehydration due to diarrhea, vomiting, loss of blood or water pills, disruption of the blood flow to the kidneys due to various other reasons such as narrowing or blockaging of the blood vessel carrying the blood to the kidneys, serious injuries or burns, severe decreases in blood pressure after surgery involving blood loss, or bloodstream infections, especially sepsis, which can cause abnormal relaxation of the blood vessels and thus not enough pressure to bring blood to the kidneys. Also, liver failure, which can bring about hormonal changes that affect the pressure and flow of blood to the kidneys. Heart failure or heart attacks causing low blood flow. In pre-renal failure, the problem does not lie in the kidneys and they remain unaffected in the early stages. However, if the condition persists, they can damage the kidney tissue permanently due to low blood flow in the kidneys. Intrinsic. In intrinsic kidney failure, the problem lies in the kidney itself, due to which the process of filtration becomes faulty or ineffective. It can be a problem in the renal tissues handling salt and water processing, or it can be an issue in the supply of blood within the kidneys. These problems can arise due to glomerulonephritis, which is an inflammation of the initial filtration system in the kidney, the glomeruli. Acute tubular necrosis, in which the tubule cells stop functioning and eventually die. Most of the filtration process occurs in these tubules inside the kidneys. Acute interstitial nephritis is another cause. This means inflammation of the interstitial renal tissue, which is responsible for salt and water processing mainly. Injuries to renal tissue and cells can also be a cause. Also, blood clots within the blood vessel within the kidney can obstruct blood flow, and chronic changes can also be caused by blood vessel disease. And finally, polycystic kidney disease. It is a genetic disorder in which numerous cysts grow in the kidneys. Postrenal. Postrenal failure includes the issues with movement of the urine from the kidneys to the ureters. The problem can be caused by blockage in the way of the urine being excreted by the kidneys. Thus, it is also known as obstructive renal failure. Obstruction in the ureters can be caused by a kidney stone, cancer or tumor in the kidney or in the urinary tract organs, or structures near the urinary tract that may block the discharge of urine, and also some medications. Obstruction in the bladder can be caused by bladder stone, bladder cancer, enlarged prostate, blood clot, and finally a neurologic disorder of the bladder, which leaves it unable to contract. With appropriate treatment, the condition can be reversed.
As a conclusion, here I have that AKI is common in pediatric critically ill patients. Most of those who develop AKI do so within the first 72 hours, lower age, higher PRISM score, and cardiac disease were independent risk factors for AKI. Though AKI was not associated with higher mortality, it was associated with significantly longer ICU and hospital stay, making it a major burden on healthcare system. Well, that was my presentation, and thank you.